Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello and welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am RipsyTech product manager Parker Anderson, and as always, I am joined by founder and CEO of RipsyTech, Tom Tarshis. Hey, Tom.
Hey, Parker. How are you, sir?
I am good. It is a new year, and it has been almost a month since we last recorded, so hopefully we still know how to do this.
Yeah, and we're actually being joined by someone else today that we'll talk about in a bit.
We will, yes, we will have a special guest today, which may be indicated in the title. We'll see. So before we dive in, quick updates on RipsyTech. I've been doing these updates, and I'm going to keep doing them for the foreseeable future. We started a course. It's called, it's a course on how to start a private practice. It's at ripsytech.com/practice. Please go check it out if you are thinking about starting your own private practice. It is an excellent free resource that we created for mental health providers like you to take all the guesswork away and give you a step-by-step guide on how to get that done on your own. All right. So what are we doing today? Do you want to introduce our special guest, Tom?
Yeah, we're very pleased to have our special guest here. Alexa, can you please say hello and welcome to the Sit and Stay podcast?
Hello and welcome to the Sit and Stay podcast. Let's dive into today's episode.
Creepy.
So we have this one is my idea. So if it's super cool, I'm happy to take full credit. And if it's semi-ridiculous, which, it's okay. Also, I'll also take any blame. But, it's oftentimes when thinking about when it's a podcast week, I think about what's been happening in life. And there was a recent upgrade to Alexa.
I love that you're owning both the potential glory and the potential chaos.
Alexa, stop. Man, maybe we'll share that. I saw that it was still listening, but there's been this upgrade to I don't want to say the name right now, where it will keep listening and respond and, pull some AI in. And it's led to a lot more conversations, especially with my 6 and 3-year-old who, to the credit of the designers, is pretty age appropriate and sometimes can do some fun educational and other things. But then I got this idea that this device, and it's another theme, Parker, that we've been talking about with people use AI for medical questions. I think it's the number one thing that they use it for. I think I saw that, and so we thought, with Parker having mentioned this is maybe something to talk about, then I had the idea because I think my daughter asked a medical question to and then I'm like, hey, let's ask some mental health treatment questions. And, can I, with my 20 plus years of experience in all aspects and treating all ages, how can I do in the questions? Can Alexa do better? I'm okay. It didn't activate, which is good. And let's just have some fun with it. So that's where we're at.
Yeah, and that's what we're doing today. So, I was also thinking about this topic because I was I kind of had a long drive. I live kind of close to Atlanta, and it's about an hour every time I drive, and I wasn't really feeling like listening to music, so I thought, oh, I will talk to ChatGPT because they updated the voice capabilities. And I was also kind of asking it questions about like my mental health or like my New Year's resolutions for my own mental health, so to speak, on top of just like other general New Year's resolutions, mental health being, I guess one of those things. I found myself having like a kind of an in-depth conversation. And I thought, there might be something here because some of these things are things that I could be talking to like friends about or maybe a provider about. But here I am kind of starting the conversation with the AI. So, getting your take on that, so to speak. But I've kind of have like my own general experiment idea in the wings. So maybe we'll be doing that one in a future episode. But I thought, this is a very fun idea, very topical, very relevant. And I think this is something that appeals to not just a mental health provider that might be listening to our podcast, but to kind of anybody. So do you want to dive in? I have a list of questions, some of which may be totally mental health specific, and others might be kind of just like slightly just medical. Do you want to do it?
Let's do it. Let's see. I'm excited to see how well I can answer and see what our co-host says.
Okay, sounds good. All right, so we'll start with you, and then we'll just repeat the question to Alexa and see what she says. Does that sound good?
Very good.
Okay. All right, first one, I'm giving you a softball here. What are some scientifically proven therapies for treating depression?
Okay. Great question, Parker. And are we going for all ages or just in kids or teenagers?
How about you're a child psychiatrist, so let's take advantage of that and let's say for kids.
Okay, so let's go to our top two that are very well validated with lots and lots of studies. And one of those is CBT, or cognitive behavioral therapy, which has been shown to do much better than sham therapy treatments for years. And the second one is interpersonal psychotherapy for depression, is a specific one for depression that has met the gold standard for evidence-based treatment. At this point, I feel like it is always this question because it's an evolving landscape with research, but I feel pretty confident that nothing else has met full criteria to be a sound therapy for depression. It doesn't mean the absence of good evidence doesn't mean something might not work. And for example, psychodynamic psychotherapy in teens, which is very hard to do a good study, could be in there. There is dialectical behavioral therapy, which is very good for certain aspects of depression, like self-harm and some other destructive behaviors, but just for treating general depression itself, I don't think it meets criteria. So CBT and interpersonal psychotherapy, 100%. Maybe some others, but I don't think anything else has met criteria. Man, I'm really trying to cover my bases there with my...
Yeah, serious. I was like spoken like a true doctor. Likes to hear themselves talk, maybe? I don't know. Just kidding. Okay, I typed the question into the chat for you so you could repeat it word for word.
Very good. And yeah, I'll have to repeat it here and let's see what happens. Alexa, what are some scientifically proven therapies for treating depression for kids?
Cognitive behavioral therapy, CBT, is the most effective treatment for childhood depression, with success rates of 60 to 70%. For children under 8, family counseling and environmental modifications are primary approaches, while older children may benefit from antidepressants like fluoxetine alongside CBT.
Alexa, we didn't really ask about medications. Is there any other therapy treatment that's scientifically proven for teenagers?
Cognitive behavioral therapy, CBT, is the most scientifically proven non-medication therapy for teenage depression. It helps teens identify and change negative thought patterns, with studies showing 60 to 70% success rates. Would you like to learn more about how cognitive behavioral therapy works for teenagers?
Not right now, but is there any other depression that has good evidence? Sorry, is there any other therapy that has good evidence for treating depression in teenagers?
Interpersonal psychotherapy and family therapy are also effective for teenage depression, with studies showing similar success rates to CBT. Exercise and mindfulness based therapies have shown promising results as well.
Thanks, Alexa. Nothing else right now.
You're welcome. Just call my name and I'll come running. Not literally, of course.
Okay, so that was interesting because it sounded like her follow-up answers to your follow-up questions were kind of just like re-summarizations of the original statement that she said, and you had to kind of dig a little bit to get her to say, something about like exercise. I didn't hear anything about dialectical behavioral therapy in there. What was your reaction to that?
Yeah, no, and I realized the interpersonal psychotherapy is only for teens. So then I was thinking, oh, I said kids, and in which case you could make a strong argument that CBT is it. Um, yeah. However, I felt Alexa deserved a little more clarification on that. I
Okay.
do the mindfulness is an area of ongoing research for depressive treatment, and so that was good. Exercise, we said therapy and not psychotherapy, so and there is some stuff happening there. So
Okay.
I'm impressed. Number one, what do you think, Parker?
I mean, if I was somebody that didn't know anything, now you've given me something to start with. I guess that's something that you got to just keep in mind is, you're getting like the first line of defense answer when your provider might be able to give you, a bit more that would be more specific to your situation. Or at least that's, what I think.
But which is reasonable, but I'm always more, yeah, I'm concerned with kind of wrong
Just wrong
information that
information.
would set
Yeah,
someone on a bad
that makes
path.
sense.
So far, so good.
Okay, okay. All right. How about this question? What is the right dosing? Sorry, what is the right dosing and time that I should take melatonin to help with my sleep?
Okay, great question, and fair to say, little controversy around this. What I'll throw out though is the, m- most sleep experts, which sleep experts get more credit in this field because of some of the shaky research, but um, in general, the right dose of melatonin is more like half milligram to 1 milligram dosing. Maybe you could argue for 2 or 3 milligrams. And instead of taking it right before bed, it is something that should be taken a couple of hours plus or minus before bed in order to get the best benefit. And because melatonin is not an FDA approved thing, although at times there are pharmaceutical grade melatonin that you can get from pharmacies. They sell 5 milligram, 10 milligram, immediate release, extended release, and there's a lot of variations on the marketing because, hey, in the US, more is better. So if 1 milligram's good,
God.
you
Yeah.
could make it 10. But for most people, and especially for kids, it's half milligram to 1 milligram, um, not right at bedtime, but a couple hours before bedtime, because of how the medication works on your sleep rhythm cycle. And then I also tend to give the advice that if you take it regularly, your body just tends to readjust based on the melatonin and stops being effective. So it works better if you're only using it once in a while. Some studies support that you can keep the dose the same, and that doesn't happen. But that is my answer.
Okay. Very good. All right. I wrote the question out in the chat. If you want to repeat it to A.
Okay. And here we go. Alexa, what is the right dosing in milligrams and time to take melatonin to help me with my sleep?
For sleep, start with 0.5 to 1 milligram of melatonin 30 minutes before bedtime. How long have you been having trouble sleeping?
Wow, what the heck?
Alexa, I prefer to take it 90 minutes before bedtime. Is that okay?
Yes, taking melatonin 90 minutes before bedtime is perfectly fine. It gives the supplement time to start working and help you fall asleep more easily.
Okay. Alexa, can I keep taking melatonin forever and will it have the same benefit?
Melatonin is generally safe for short-term use, but long-term effects aren't fully understood. Have you been using it for a while?
That's too personal, Alexa.
I hear you. I'm here when you need me.
Okay, that is I think that's pretty notable because I just Googled, buy melatonin Kroger. Kroger's the grocery store that's closest to me. And most of the available options come in 5 milligrams and even 10 milligrams. There's only a few options that are as low as 1, although it does look like some brands are doing 2.5 as well. But yeah, it's kind of all across the board: 1, 2.5, 5, and 10.
Yeah, I'm shocked and I thought for sure that would be one where like it's totally wrong but man, I can't believe it nailed the dosing. I don't think it got
Maybe she's listening right now.
the time perfect, but it did say 30 minutes before bed instead of at bedtime, so it was and it said on the follow-up like that was okay. I'm yeah, I that's cool. It's batting, 2 for 2 in good advice at this time.
Okay, okay. How about okay? How about that? I wrote this one.
Okay, bring some humor. Let's do it.
All right. I heard zinc is good for my immune system. I'm now taking 50 milligrams a day that I bought at the store. How does that sound?
Well, Parker, this is zinc is definitely marketed as something that's very good for your immune system. In fact, there is there it's a product that's also marketed as something to reduce cold duration. And I will say that there is 1 or 2 studies that does show that zinc lozenges when you're sick with a cold may reduce severity and symptoms, especially if you take it early. It doesn't quite meet the Tarshis standard for gold evidence because it hasn't really been replicated it's the same group that did a lot of those studies. So that being said, there is some research to support these zinc in lozenge form, not necessarily taking the supplement pills that you talk about, for helping with colds. As far as zinc for having good established studies that it actually helps with any other type of illness, that there's nothing solid that I know of. There is biological plausibility to this, which is why it's marketed as such, because of some vital pieces of zinc that are needed for immune system. But the actual taking of zinc as a supplement is not scientifically proven with overall benefits for immune system.
Now, what did you think about the dosage that I said, taking 50 milligrams a day?
Oh, that's a good question, Parker. And I would say there's no dosage because it doesn't meet it. I'm putting my money on there is no good scientific evidence that it actually um, has been proven to actually help your immune system. And so I don't know enough about, I don't even know what milligrams they sell like zinc supplements in. So
Okay. I'll kind of give a little bit of background on why I asked that question, but I will paste it there in the comment. Let's get our response from our co-host.
okay, Alexa, I heard zinc is good for my immune system. I'm now taking 50 milligrams a day that I bought at the store. How does that sound?
The recommended daily zinc intake is 8 to 11 milligrams for adults. 50 milligrams exceeds the safe upper limit of 40 milligrams and could cause side effects.
Alexa, is there any scientific evidence that zinc can actually help with my immune system?
Yes, scientific evidence shows zinc plays a crucial role in immune system function. It's involved in regulating both innate and adaptive immune responses. Would you like to know more about how zinc specifically supports your immune health?
Alexa, I'm not talking about biologic plausibility, but are there any well done scientific placebo controlled studies that show zinc helps your immune system?
Yes, there are placebo-controlled studies showing zinc's immune benefits, especially for older adults and those with deficiencies. Would you like to know about a specific study's findings?
I would, but not about zinc deficiency, which is obvious that that affects immune functioning. But I'd like to know a study, placebo controlled, that showed zinc had actual benefit for immune system.
A study found zinc reduced cold symptoms by 2 days compared to placebo in healthy adults. Would you like to know more about this research?
I already mentioned that research. Is there anything else on zinc supplements and immune with the placebo controlled studies?
A meta-analysis of 28 randomized controlled trials found zinc reduced respiratory tract infection symptoms by 2 days compared to placebo. Would you like to know about zinc's effects on specific immune markers?
No, thanks. That's enough.
Got it. I hope the zinc info was helpful.
Well,
Okay, what did you think about that?
Well, it was, I liked the first part talking about the milligram and dosing and what was unsafe. Like, that was good. Sort of skipped over the study question. And so I took advantage of that to add in a, scientific, etc.
Yeah.
What are my thoughts? To me, it seems like then it went to just the study done by the makers of these lozenge supplements, because it is good that then Alexa quoted a meta-analysis, because often when lots of people are doing something or it's being marketed, some people will go in and find any study of any quality and put the data together and see what they can do. And it seems to be around the sort of respiratory tract, etc. I would bet my money that the quality and the when you do a meta-analysis, you get some findings and then you sort of say, well, we're confident about these findings or we're not confident. I bet that it is low. So I feel like I hopefully got it right. And then I think the concern is that Alexa wouldn't really come out there and say, hey, there's nothing great that really shows that this supports immune system.
A meta-analysis of
Alexa,
34 randomized
stop. Now, I do also have access to the open, and we can maybe do this next week or as we delve deeper. I have the open evidence as a physician that you can throw in the same questions, which I have a little more faith in than our co-host. But
All right. Very interesting. Yeah, so I mean the reason why I asked that question is because I myself as a general person, as a lay person, so to speak. I bought zinc from the store because it's supposed to help me with my immune system. Good, I'm trying to put together, what vitamins should I be taking on the daily. And then I actually asked ChatGPT about, my vitamins, and it had told me like, oh, well, they gave you, that bottle has 50 milligrams of zinc. That's actually too much for what you should be taking in a day. So that is, I guess, my little warning to people that maybe you think you're supposed to be taking something, but what you're buying at the store, the dosage might be too high for what you should actually be taking every single day. So it helps to be somewhat informed on that when you're just choosing to make those types of health decisions. As for the rest, that was actually pretty informative for me.
In all fairness, and it's interesting you asked this, I do find those lozenges to be helpful. And
yeah,
I use them the second I feel like I have a cold coming, I use it. And of course, there are other psychological principles that go into immune system and the reasons for things, but I feel it's helpful to me. I don't have the GI upset from zinc that many people get as a unpleasant side effect, so I'm able to tolerate it. But
as a quick aside, I had gotten sick as soon as I landed in California to visit my family for Christmas, and not wanting to be sicker than a dog on Christmas, I kind of came up with like a whole game plan of what I was going to take and when, and what salt water gargles before bed and honey and all of that stuff with ChatGPT. Like it kind of gave me this whole, I was like, let me see how good it would be at kind of helping me like optimize getting better as quick as possible. And I did do the zinc lozenges as well. And I will say I actually felt pretty, I woke up sick on Monday, and by Christmas I was feeling a lot better. Definitely on Friday I was like almost, I was like 90%. So I'm not condoning necessarily that you optimize your medications with ChatGPT, but the world is changing. I don't know. So useful potential use case there. I don't know.
Yeah.
That's a less risky scenario than something that you should actually go consult your medical provider about. Okay.
Yeah. Can we get one where Tom beats the device? I don't know now, but I will take that if we are giving good mental health or other medical information to people. So.
Okay. Well. Okay. I'm trying to be mindful of the time. I have a couple that I really want to make sure that I ask, but then I have one that maybe I should ask. I'll go with this one. Tom, I saw on a TikTok that magnesium and vitamin D ought to make my anxiety go away. Should I do that?
Oh, okay. Like good questions. And interestingly, I've given presentations on alternative medicines in psychiatry. There is a definition to CAM, complementary and alternative medicine treatment, that is, well respected, and lots of things that have good benefit. You are specifically asking about magnesium and vitamin D, which, in my extensive research into what's available on treating anxiety with alternative methods, those do not show up as something that are potentially helpful for anxiety. There are things that are, however, and one, what will I mention? I'll mention L-theanine, which is a big component in green tea and is something that's been known to have anti-anxiety effects, as well as help with sleep. There's some, not actually Tom level evidence, but there's some quality research around. But I'm saying there is no empirical scientific evidence to support vitamin D and magnesium for anxiety treatment, despite there being some biologic plausibility underneath it. But
Okay, pretty solid. I'm kind of curious what Alexa might say to that.
Alexa, I saw in a TikTok that magnesium and vitamin D ought to make my anxiety go away. Should I do that?
While some studies suggest magnesium and vitamin D may help with anxiety, the evidence isn't definitive. It's best to consult your doctor before starting any new supplements.
Alexa, can you give me the reference for one of those studies?
A 2024 study of 12,232 adults found higher vitamin D levels linked to lower anxiety risk. Would you like to know more about this research?
No, because it sounds like it was a cross-sectional study.
You're right. It was a cross-sectional study. Would you like to know about a
Wow.
randomized controlled trial on vitamin D and anxiety instead?
Yes, I would.
A 2022 randomized controlled trial found vitamin D supplementation improved anxiety symptoms in elderly people with prediabetes. Would you like to know more about this study's findings?
No, but is there any study that includes a healthy population with anxiety and no deficiencies or pre-existing conditions?
I couldn't find a specific study on vitamin D for anxiety in healthy adults without deficiencies. Most research focuses on populations with deficiencies or other conditions.
Thanks, nothing else.
Okay, that is interesting.
You're welcome. Happy to help with the research.
I love that response. I love the response.
Yeah, that was a good response. I will say you are asking like the most highly informed follow-up questions that your average person would never be asking. Something to be mindful of. I asked this question because I actually did see this TikTok maybe like 3 years ago where this guy was like, I started taking magnesium, I started taking vitamin D, and I used to be anxious all the time and my anxiety went away. And I remember seeing that and thinking like, is there any scientific backing with that? And then I remember a few weeks later I saw, because I guess that TikTok blew up, and so people started kind of saying this to themselves, or between themselves on social media and whatnot. And I saw this article that somebody had just interviewed a psychiatrist and asked about this, and she said, well, if you're deficient in those vitamins and now you're actually taking something for those vitamins, like that might be helping with some kind of, imbalance, and that just might have a side effect of like whatever is, your anxiety might just, if you, just poor vitamin deficiency, then like, I don't know, maybe, but like, I don't want to like misquote this, but so that's something that I just kind of thought of that like 5 minutes before we recorded the episode. So that was interesting.
Yeah, and it's but a lot of the supplements and other things we know for sure deficiencies cause problem. Like we know zinc and iron deficiency in ADHD in kids like makes things much worse. And magnesium deficiency affects your muscles, and so you could see where there could be a deficiency there. I think the most common bias there. Well, and let me not nerd out on the world with epidemiology and biostatistics, but people are like, okay, I'm going to start exercise, I'm going to eat better, and I'm going to take these supplements, and then what is it that makes someone feel better? It's not right. It's probably not what you think it is, but if you're cool and you make a TikTok, if you got a good marketing TikTok video out there, and hey, anxiety with 1 in 3 adults has, clinically, and 100% have some, like it's going to get there. So I do. Yeah. The first response was great. Sort of like, not really. And ask your doctor, which is what it should default to.
Yeah, totally.
Yeah.
That was very, very interesting.
I know we're short on time, but I wonder if I could do one more, like, can we do a direct, like, starting dose of a medication type question.
Oh, yeah. We did talk about maybe Prozac if you wanted to do that one.
Okay, yeah. So
Well, what would be your answer?
yeah, so I always like to start medicines. Um, so for Prozac, I would, for a kid with anxiety or depression that hasn't responded to therapy or other pieces, it would be a 10 milligram tablet, but the first 4 days, let's break that in half and do 5 milligrams, and then maybe get up to 10 milligrams and hold there. For an adult, maybe you would do half of a 20 milligram pill and do that initially for maybe 8 days and then go up to the higher dose, although some people will get benefit as low as 10. This question is an issue because often people will go maybe to a primary care doctor and get a starting dose that is too high, and my side effects are usually mild from this class of medications. But if you start at too high, you get an unpleasant experience, and then that's maybe hurt any potential benefit. So always want to go, always start with lower dosing. So I do 5 for kids and then 10 for teens and adults.
Okay.
Right.
Good answer.
Alexa,
Go ahead.
what's the correct starting dose for Prozac?
The typical starting dose for Prozac is 20 milligrams per day for adults with major depressive disorder. However, dosages can vary based on the condition being treated and individual factors.
Alexa, is it appropriate to start people on 10 milligrams?
Yes, 10 milligrams is an appropriate starting dose for Prozac in some cases. It's commonly used for panic disorder and can be used for major depressive disorder in lower weight children.
Thanks, that's all.
You got it. I hope that info was helpful.
So the lower weight children comment is ridiculous because dosing for SSRIs in kids is not really based on weight. And in fact, those medicines, if you have a lower weight kid, there's good evidence that these fat soluble medicines don't work well. So I feel like, how do we, yeah, so I guess I'm not surprised by that answer. And I think that's
Yeah.
maybe even listed on the drug monograph. But I can't tell you how often start low, go slow. These medicines take a while to start working anyway. So there's no difference. There's no reason to start at a high dose that could cause side effects and hurt treatment. So the Dr. Tom answer is start much lower. And then after a few days go up, much less likely to have side effects. And then people will stick with it.
Sounds good. Okay, yeah, super interesting. And now let's take a quick break with Rai, our mental health practice advisor.
This is Rai, your AI mental health practice advisor. Practice owners often ask, what's the single biggest mistake clinicians make when starting a private practice? When starting a private practice, the biggest mistake you can make is assuming a long patient waitlist will quickly turn into a full schedule. Interest isn't the same as consistent attendance, and hiring new clinicians before revenue is predictable creates immediate financial strain. For more practice advice, ask me a question at RipsyTech.com.
Okay, Tom. I want to do a Tom take with you. Get your hot take. I'm gonna give you 60 seconds. I'll signal to you when you have 10 seconds left. Here is the question. What's your take on patients discussing mental health issues with their home assistants, like Alexa?
Well,
Go.
Okay. And there's this AI backup Alexa, it's okay. part of me goes to like any discussion about mental health issues is good and getting it out and open, and the world's come a long way, and mental health being front and center, and it's not as stigmatized anymore. This is happening so much in the world, and there have been cases of bad things happening, very bad things. All that being said, in our AI world, the more people do actually talk about this to these devices, that then, the more data and more questions, the more refined and better they can get at answering it. I've heard people talk about that. There's usually appropriate mental health advice about calling whatever number if there's problems and things like that. So it's hard because it's going to happen, and I don't know. But, I'm a realist, so saying just don't do it's not going to work. So let's try to embrace it. And in general, I feel okay with it.
That's it for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we would love a rating or review wherever you're listening. And if you'd like to get in touch, you can always email us at sitandstay@ripsytech.com. And this was fun, Tom. I will see you next time.
Thanks, Parker. Appreciate it.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at ripsytech.com.